Could you talk me through some of them?
Okay, so 3 in 10 children are not being seen within the 18-week time frame, which is it's a worrying statistic. There are also 1 in 5 people having their referrals rejected for a kind of variety of reasons, which is also quite a startling statistic. So a lot of the impact is not just for the young individual, it can be an impact community-wide, family-wide, impacts on their education, isolation, social inclusion, right across. If somebody has reached out for support with mental health, it is because it has been having an impact and affecting their lives. There are a lot of third sector organisations out there that are well placed to be supporting these referrals and providing the same services, but the funding's not there for the third sector to be able to. But when you look at that 7% of the budget being used, if that figure was doubled and distributed across third sector, would we see a reduction in waiting times? Yeah, absolutely. The NHS is a wonderful service and it's there for everybody. However, people are struggling to access it because of the demand on the service. So rather than it all being through a statutory provision, look to the third sector to support that statutory provision. Anybody having to wait 18 weeks for a service when they've reached out to say I need this service, waiting 18 weeks isn't good enough. What I'm suggesting is we provide much more early intervention, so going in at early year stages, primary school stages, secondary schools, providing people with mental health coping strategies, healthy coping strategies, ways of identifying in their peer groups, supporting these kind of things, that we will hopefully avoid the crisis point, because by the time they should never reach the crisis point would be the ideal scenario, but that isn't always going to be avoided. But what it does mean then is if we have an early intervention and prevention system in place, then when people do have a crisis, there's an easier access to the service.